doing some pin stretch. If we figure out that flexion is that directional preference, it's really nice to work through repetitive bending and repetitive flexing while digging into the joint line and releasing a lot of the hamstring calf tightness and getting a good reset on like the distal quads. Also, trigger point release just in general with that knee in place, kind of just again, really getting deeper into those tissues, get that neurological reset and blood flow to them to calm things down. And last, being chiropractors, of course, we love our chiropractic manipulation therapy. What I'll generally do is if it's an osteoarthritic knee, I'm generally not going to thrust on that. I find that a good heavy mobilization into repetitive knee flexion is really effective. And especially kind of putting a little bit of a block on the back of that knee really opens up that knee and those osteoarthritic um, uh, components at that knee and really heals things along pretty nicely. It's also rather nice, even if the functionality only improves at the knee by 5-10% by doing some stabilization and some work at the lumbar spine and at the pelvis. I think it's always just a good idea to work upstream from that and make sure that everything at the pelvis, neurologically, nerve space wise, is as open as it possibly can be. And that like the pelvis is kind of like as positioned as correctly as it can be.